Did you experience tethered oral ties with your baby? Have them revised or released and expect whatever difficulties were occurring as a result of the tethered oral ties, the tongue tie or the lip tie, or the buccal ties, buccal ties, to just resolve, to magically fix themselves because of the surgery, and then you were left disappointed by the fact that your feeding difficulties didn't resolve and you were left to figure it out on your own, or to go on a long journey of meeting with a million different people to try to resolve your difficulty. I see this so often. And while I don't 100% have all the answers, I have a lot of thoughts about this. And I would like to share a few of them with you today. And then if you have any thoughts about this, I would love for you to share them by joining my Milk Making Minutes community group on Facebook, because I really do believe that this is such a barrier to families getting good care. So join me there. And in the meantime, here's what I have to say about this topic.
When I began breastfeeding, I was blindsided by how difficult it was. Having known only a handful of people who had ever done it and only seeing it up close a couple of times, I had a huge learning curve. Since then, I've become a doula, a childbirth educator, and an internationally board-certified lactation consultant, or an IBCLC. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore the systemic, medical, and cultural barriers that make feeding our babies so difficult, so that you know your baby feeding struggles are not your fault, and your triumphs really are the miracles you feel they are.
Often, here's what I see. A baby gets diagnosed with a tongue tie. When they get diagnosed, it is often based on what somebody is seeing. A very obvious, tight frenulum, very obvious tissues that are tight. And often somebody like a doctor in the hospital or a pediatrician is diagnosing the tongue tie, or the parent is saying, I think my baby has a tongue or lip tie. And they are presenting it to the pediatrician and asking, what should I do about this? And the pediatrician may agree or disagree. And if it's very obvious, this parent might get some help. Now, I have the privilege of working as a contracted provider in a hospital setting a couple of days a month. So my primary focus is my private practice, but I do think it's important for me to understand the hospital setting, and I do want to provide that service to families in the hospital. And I often see that when there is a very obvious anterior tongue tie, meaning the frenulum underneath the tongue connects to the bottom of the mouth, underneath the tongue, towards the front of the mouth, and there's a very tight restriction, it will get diagnosed and then it'll just get snipped right away. And often we will see in these babies that the infant has difficulty latching, maintaining a latch, and that the parent struggles because they are in pain.
I am so pleased to announce my new partnership with Feast and Fettle, which is a locally prepared home delivery meal service. When I ordered from Feast and Fettle, I was able to select from a list of delicious meal options that got delivered to my front door for the entire week. Some of the options that I chose were some zucchini lasagna, some challah bread, some roasted carrots, some pork fried rice, and everything that we ordered, we devoured. It was really so delicious, and all we had to do was heat and serve it. I highly recommend this service as a way to get just one more thing off your plate so that you can spend more time focusing on your family and less time worrying about all the things you have to do, which we know is really good for your milk supply. If you would like to order from Feast and Fettle and just try it out, you can go to feastandfettle.com and use my code MILK milk to get $30 off your first week and let Feast and Fettle do the cooking for you.
The other scenario that I am now seeing often in my private practice is that I will get called after somebody has determined that, yes, their baby has a tongue tie. These babies are often struggling to feed in some way. And so they're bringing up these difficulties with their pediatrician. Their pediatrician may refer them to a pediatric dentist, or they might know somebody else whose baby had tethered oral ties. And so they tell them to go see so and so pediatric dentist. They go into the pediatric dentist's office. The pediatric dentist does the releases and then says, by the way, you should call an IBCLC. And then somehow they call me and I come out. So I never was able to even see what was going on before the tongue tie release. And now I'm working with the family afterwards to try to improve feeding either at the breast or with a bottle after the release. And we are all taking our next right step given the information that we have. Even me as a lactation professional. So the things that I do and say now about tongue tie are very different than I said a year ago and are very different than I said 2 years ago and are very different than I said 5 years ago, because when you know better, you do better. And I thought I knew a ton about tongue tie because I myself experienced it. And then as I launched my private practice and entered the field as an IBCLC, I realized, oh my goodness, I think I need to know more about this. And I've been diving into the topic. And luckily, I've been taking a course. Lisa Palladino, she was a guest of my podcast. She's the host of the Tongue Tie Experts podcast, and she offers a course for professionals, not just for lactation professionals, but for doulas and chiropractors and pediatricians and speech therapists, anyone who might work with families of infants who might have some connection to tongue tie, which is amazing because then you get to kind of network with lots of other people who are connected to families and their infants. So as I'm taking this course, I'm learning all the things that I didn't really understand, that I didn't know before. And it's empowering me to be able to help families in a way that I wasn't able to help them before I took the course. And what I'm seeing now is that we focus so much on the procedure of the frenectomy, of releasing the tissue. And I did this too. With my own son, we put so much hope in thinking that everything is going to change after the procedure that we forget how much of the baby's musculature has built up around how the mouth was structured with the tongue tie as it was. So breastfeeding is very dependent on the ability of the tongue to move in very particular ways and the ability of the lips to create a seal. And the tongue is a muscle, and the lips have muscles inside of them to be able to do that. And if there has been anything getting in the way of creating that seal or getting in the way of allowing the tongue to lift towards the hard and soft palate, where the hard and soft palate meet, to create the suction and move in the way it needs to move in order to squeeze the breast tissue properly, to draw out the milk in a way that is both effective for milk transfer and comfortable for the feeding parent, then it makes breastfeeding more difficult. And just releasing the tissue and freeing up the tongue does not mean that the muscle can now do that work. Because for all the time that the tongue was tethered, which happens very early on in the development of the fetus, that musculature was not building in that way as the infant was moving their tongue around in their mouth, sucking their thumb and uterus, doing all those things, getting prepared to breastfeed. And then sometimes the tethered oral ties aren't even recognized until 2 weeks in, 4 weeks in, 10 weeks in. And so it takes a lot of work to do that tongue development, even if the tethered oral ties are recognized immediately. However, I can't say it at the hospital, but when I see that a procedure is being done in the hospital, I actually don't have faith that procedure is going to really help the family optimally because A, there is work that can be done with that infant before the procedure happens because tongue tie is not something that is diagnosed or assessed just by looking at the infant's mouth. It's really a functional diagnosis, as Lisa Palladino likes to say. So the way that tongue tie should be diagnosed is not only how the tissue looks, but how it is impacting the feeding dyad. And she really talks about this in 3 categories. She talks about it thinking about how it is impacting the baby, how it is impacting the feeding parent, and how it is impacting the feeding itself. It could impact the baby by having slow weight gain. It could impact the baby because the baby is really colicky or fussy. The baby could fall asleep a lot on the breast because they don't have the optimal tongue development to be able to transfer milk well, and so then they just fall asleep. Baby could be misdiagnosed to have allergies. Baby could have actually really high weight gain because sometimes we see that the mother or the feeding parent tends to have an oversupply to overcompensate for this. Baby might be really a chompy feeder because they are clamping down to try to manage the flow of milk. There might be a lot of pain for the feeding parent during breastfeeding, either on the nipple or vasospasms of the breast in the breast tissue. And and then there's lots of things that can be happening during the feeding itself as well. And so these are the things that we are really looking at to see, is this a tongue tie? And so we can't know this on day 1 when the baby's born. We have to really assess feeding over a period of days or weeks. So just looking in the baby's mouth and then making a cut isn't really going to be an ideal situation. Secondly, if we're seeing some of these symptoms, what we first want to do is work with the infant to try to strengthen their tongue through oral exercises and through ideal breastfeeding. And that is best done with an IBCLC, with perhaps a craniosacral therapist who can move the spinal fluid in the head and the spine through a very gentle touch to try to see if we can decrease tension in the body from birth trauma or from the way baby was positioned in utero through some chiropractic work. It's really a team approach that needs to be taken before the release. And then once the release happens, there are multiple players. They're going to be trying to help the mom and baby. Here's where my frustration comes in. I know this. I know this is the best way to approach this situation. However, it is hard enough for families to get insurance to pay for coverage with a lactation consultant. And so if a baby has tethered oral ties, a tongue tie or a lip tie, and they discover this, and the only way for them to have a hope of having better outcomes is to have it snipped in the hospital right away, because they're not going to be able to go to a pediatric dentist later and have that procedure covered, or because they don't have the resources to do all the digging into all the care they need, because we have no standard approach to treating this, because there's no standard schooling on how to help families with tethered oral ties. And I know that families are already spending hundreds of dollars out of pocket to get the care they need, and they want what is the very best for their babies. And so, as a practitioner who wants the best for my families, it is so infuriating to see that families feel as if they have gotten thrown on this roller coaster ride of trying to help their babies feed better when they have tethered oral ties, and often they feel duped when they get the releases and then they're not seeing their babies improve, and it's because they really do need a team approach. But A, there might not be enough practitioners. B, nobody's telling them they need a team approach. And C, even if they are told they need a team approach, sometimes they have to choose between which providers they are going to see and which providers they aren't, because not all families can afford to see hundreds of dollars worth of practitioners every single week to help their babies to feed better. And so if you have been in this situation, I just want to say, I see you. I see your struggle. And I want you to know that you are making each next right step as you see fit for your family. And that tongue ties are complicated. The best way to treat tethered oral ties is debated amongst all of the key players, all of the practitioners who try to help families whose babies have them. There is a good body of evidence out there on the best way to treat them, but not enough. The field is evolving. It is so much better now than it was 10 years ago when I was dealing with it as a parent. And in 10 years, it will be even better. And I hope that our systems are even better to support the families who are navigating how to help their babies feed better when they discover that their babies have these tethered oral ties. So if you are in this situation, there is no guilt to be had about any decision you make, because none of us have a crystal ball. We can give recommendations based on our clinical experience, based on our knowledge of the research, but in the end, none of us can say exactly what will happen with your baby if you do A, B, or C. We can't say it, and you can't say it. So we are here to advise you. We are here, we being the experts like the IBCLCs and the pediatric dentists and the craniosacral therapists and the chiropractors. We believe very strongly that we are advising our clients and our patients in ways that will help them navigate their particular situations to get positive outcomes, and we don't have a crystal ball. So you can feel confident you are just going to make the best decision you can, given the information you have, the resources you have, and the experts that are available to you to help you make those decisions. And in the end, your baby will be well fed. And some of us have easier feeding journeys than others, and it sucks when we have difficult ones. And I see you and I get it when your journey is difficult. If you are having a difficult journey, whether it's due to tongue tie or a supply difficulty, bottle refusal, or breast refusal, I would love to be the person who helps you navigate that. And I am confident that I can help you make your next right decision, because that's all you can ask of yourself. So go right now to my website, www.quabbinbirthservices.com, so that you can reach out to me and I can get you put on my calendar. I can't wait to hear from you. Talk to you soon. Bye.